This timeline explores the evolution of Germany's healthcare system, starting with Otto von Bismarck's push for social reforms in 1862. As Prime Minister of Prussia, Bismarck laid the groundwork for social insurance by advocating for health insurance laws that made coverage mandatory for industrial workers. In 1883, the first comprehensive health insurance law was enacted, with insurance financed through employer and employee contributions, establishing the Bismarck model. This model expanded over the years, introducing accident insurance in 1889 and old age and disability pensions by 1911. Both helped to reinforce the social insurance system. After World War II, reforms were aimed at restoring trust in the healthcare system, especially in East Germany, where insurance became more state-controlled, yet retained aspects of the Bismarck model. In 1950s and 60s, the system evolved further, extending coverage to self-employed and low-income individuals and enhancing benefits. In the 21st century, Germany faced rising healthcare costs, prompting modernization focused on efficiency and quality of the insurance system. Key legislation, like the Patient Rights Act of 2013, emphasized patient autonomy and rights. These high points illustrate how the healthcare system has been shaped to meet the needs of Germans. It will continue to evolve with time to allow for further improvement in access and quality of healthcare.
We will now move into the Key Figures Gallery and learn about 4 of the most influential individuals who shared the development of Germany's healthcare system. You are encouraged to read the museum label below each figure. The most famous, influential, and namesake is Otto von Bismarck. He was born into a prominent Prussian family and became the Prime Minister of Prussia in 1862 and pushed for German unity through blood and iron. By 1871, he declared a new German empire and became Chancellor, implementing social reforms to garner political support. His Health Insurance Act of 1883 established the world's first social health insurance system, founded on solidarity and self-governance. The social health framework aimed to prevent unrest and appease social democracy supporters by offering mandatory medical insurance financed through employer and employee premiums. Bismarck understood the need for a healthy workforce to solidify Germany's dominance and exchange social rights for political rights. He famously stated that the greatest burden for the working class is the uncertainty of life, emphasizing society's obligation to care for the poor. Bismarck's legacy persists. Almost all Germans today remain part of a sickness fund. The next key figure we come upon is Rudolf Virchow, often called the father of modern pathology. Virchow was a physician and politician who advocated for social reforms and public health, highlighting the connection between social conditions and disease. He stated medicine is a social science, linking his views to social determinants of health. Virchow promoted healthcare access and initiated public health improvements such as sanitation reforms during typhus and cholera outbreaks. He pushed for better medical training and criticized the government for neglecting the poor. While he supported Bismarck's initiatives, he critiqued the welfare system for not meeting the needs of the impoverished. His political involvement included founding the German Progressive Party and serving in the Prussian Diet and German Parliament. He was a key figure in advancing social justice and healthcare. The next key figure we come upon is Angela Merkel, the first woman chancellor of Germany who served from 2005 to 2021 and significantly influenced health policy, focusing on access and reform. Her leadership aimed to balance costs with quality healthcare access. Reforms within the statutory healthcare system helped reduce inefficiency and improve care for vulnerable populations. Merkel emphasized preventive care and digital health technologies, modernizing the system. In 2006, she implemented changes that increased employer and employee contributions to the sickness funds and passed a health insurance duty, mandating insurance coverage through public or private systems. Additional reforms in 2010 further increased contributions while shifting future increases to employer burdens. She also prioritized a sustainable system capable of supporting an aging population. Merkel's management of the 2015-16 refugee influx raised questions about Germany's commitment to universal care, as restrictions on entitlements for asylum seekers created tensions regarding funding and staffing within the healthcare system. Towards the end of her chancellorship, she led a coordinated response to the COVID-19 pandemic, showcasing a robust public health system that managed the crisis more effectively than many other countries. The use of technology, including telemedicine and electronic health records, expanded significantly during this period. Overall, Merkel was regarded as a successful leader in healthcare, with her commitment to social justice helping to sustain the core principles of the Bismarckian welfare state while adapting to modern-day challenges. We next come upon our last and very influential key figure, Karl Lauterbach. He is a physician and epidemiologist and has served as Germany's Federal Minister of Health since 2021. He is known for his advocacy of universal health coverage and improving access to quality care for all citizens. His focus areas include digital health, data integrity, and preventive care. During the COVID-19 pandemic, Lauterbach devised effective public health strategies and emphasized mental health funding. He advocates for social justice and criticizes market-oriented policies that prioritize profits over patient care. Currently, he is working on restructuring the hospital sector to ensure sustainable healthcare financing. Lauterbach's commitment to strengthening the public health system aligns with the principles of the Bismarckian welfare state.
We will now move into our culture and ethnography exhibits. Starting on the far left, you can see a gavel. This gavel symbolizes the law that currently requires all German citizens to have healthcare coverage. Citizens can choose between statutory health insurance, which is the public health insurance system, or choose a private health insurance option, which is typically administered through an employer. Next to the gavel, you'll see a German insurance card. This health insurance card symbolizes the link between employers, employees, healthcare providers, and the government. These are all key stakeholders in the Bismarck healthcare system. Employers and government provide health insurance options that employees and citizens can use. And healthcare providers deliver healthcare services, including things like medical treatment, hospital care, and preventative services to those employees and citizens with coverage. In the center, you can see a Bismarck monument replica. This is actually the first statue of Otto von Bismarck in Germany that was erected in 1877. It's a significant historical site honoring Bismarck's contribution to Germany. It's located in Bad Kissingen, which is a city that Bismarck frequently visited throughout his life. Otto von Bismarck, as you now will know, established the world's first national social health insurance system in 1883. Next to the replica, you'll see a hospital bill. While countries with the Bismarck healthcare model generally tend to have lower healthcare costs compared to the United States, they still tend to be higher than those countries with other healthcare systems, such as the Beveridge model or the national health insurance model. This hospital bill is a tangible and often daunting reminder of the high costs associated with healthcare. The line items and total amounts can symbolize the financial burden that many people seeking medical care still face. And lastly, we have a backpack of a non-citizen. While the Bismarck healthcare model provides healthcare coverage to its citizens, non-citizens typically fall through the cracks and generally have limited access to healthcare. Pew Research estimates that there are currently over 1 million unauthorized immigrants currently living in Germany. This backpack represents the journey of undocumented immigrants, of their belongings, memories, and hope for a better future. As access to care is limited, they often have to travel far to seek medical treatment or rely on temporary solutions. The nomadic nature of having to carry essential items in a backpack underscores the ongoing struggle to find consistent quality care and the instability they face in everyday life. Next, we'll move into our ethnography exhibit. Judaism is an ethno-religion today that makes up approximately 200,000 citizens in Germany. Their culture, history, and traditions have made a lasting impact on Germany and provide unique insight into how groups of individuals interacted with the Bismarck healthcare system. Starting on the far left, you can see a Worms synagogue replica. This represents a strong link between the Jewish people and the country of Germany. It's currently the oldest existing synagogue in Germany and was built in the year 1034. Next to the synagogue, you can see a mezuzah. Jewish medical practices have been influenced by their tradition and laws, which provide guidelines on health, hygiene, and medical care. Things like kosher dietary laws, circumcision, and Shabbat observance are all examples of Jewish healthcare and medical practices that are deeply rooted in religious tradition and cultural values. These traditions emphasize the importance of maintaining health and well-being as part of religious observance. Behind these items on the wall, you can see two items. The first is an SS uniform painting. Jewish people in Germany interacted with the Bismarck healthcare system largely in the same way that other citizens did and benefited from universal health insurance coverage that was established in 1883. However, their experiences were significantly impacted by the rise of the Nazi regime in the 1930s. Under this regime, Jewish doctors and patients faced discrimination and were excluded from the healthcare system. Many healthcare professionals were dismissed from their positions, and Jewish patients were often denied access to medical care. The Nazis also excluded Jews from the social insurance system, which included healthcare, as part of their broader persecution of Jewish people. Next to this painting, you'll see a prisoner uniform during the Holocaust. And unfortunately, the persecution of Jewish people during World War II did not stop at the exclusion of healthcare services. These striped Holocaust uniforms represent the mass genocide of nearly 6 million Jewish people in Germany and across Europe. These uniforms were intended to dehumanize and identify prisoners. And lastly, below the uniform, you can see a DNA model. This DNA model represents the Jewish people of Ashkenazi descent. The people of this Jewish descent have a unique genetic heritage and have higher carrier rates of certain genetic diseases due to the founder effect. Some of these diseases include Tay-Sachs, Gaucher's disease, and cystic fibrosis. With higher disease rates than the average population, individuals with these health conditions need frequent access to quality health care. Ultimately, all of these items represent how the Jewish people specifically have a unique experience in Germany and with the Bismarck healthcare system.
I'm going to take you through a fascinating journey of scientific concepts, discoveries, and technological advancements with a spotlight on Germany's pivotal contributions to modern science and medicine. Our story begins in 1897 in Wuppertal, Germany, with chemist Felix Hoffmann at Bayer. Hoffmann synthesized acetylsalicylic acid, marking the birth of aspirin, the first commercial tablet. It was originally developed to provide his father with a less irritating pain relief solution. Aspirin not only revolutionized pain management, but also introduced antithrombotic properties, which significantly impacted preventative medicine by reducing heart attacks and strokes. This marked a massive leap in pharmaceutical manufacturing and global healthcare practices. Moving to the discovery of X-rays in 1895 by Wilhelm Conrad. While experimenting with cathode rays, he accidentally discovered X-rays, which was depicted here by the first human X-ray image of his wife's hand. This transformed diagnostic tools by providing a non-invasive method to look inside the human body. We then see the emergence of methotrexate in 1940s by biochemist Sabaro. As one of the first drugs used in chemotherapy, it played a crucial role in the treatment of various cancers, especially leukemia. This highlighted Germany's significant role in the development of cancer treatments. In the field of imaging, Germany's Siemens was instrumental in advancing MRI technology. The MRI of a bell pepper here showcases the technology's ability to detail internal structures non-invasively, which opened new doors not just in the medical diagnostics field, but also in botany and food science. Next, the invention of the electron microscope by Ruska in 1931 revolutionized our ability to view the world at the nanoscale level. This breakthrough significantly extended the frontiers of cellular biology and material science. Now talking about the healthcare innovations in Germany. In the healthcare technology field, the introduction of the electronic health card, EGK, in Germany enhanced data security and healthcare efficiency. This was done by ensuring vital health data is easily accessible across various care points. In regenerative medicine, German researchers are at the forefront of utilizing stem cells for repairing damaged tissues and organs. This offers new hope for treatments and degenerative diseases and severe injuries. In the realm of cardiovascular advancements, Germany's pioneering development of artificial heart valves in the 1960s laid the foundation for modern valve replacement technologies, which improved patient outcomes dramatically. Finally, from the perspective of healthcare providers and medical researchers, these innovations build the foundation for Germany's leadership in healthcare technology. They emphasize that consistent investment in research and development is very important for advancing global health outcomes. Overall, these pivotal contributions not only showcase Germany's rich legacy in scientific and technological advancements, but also their enduring impact, improving and saving lives across the globe. Thank you.
Hi, welcome to Gallery 5. I am Zakia, and today I'll be guiding you through an engaging exploration of Bismarck model of healthcare via a lively game of shoots and ladders. In this interactive experience, players will dive into the world of Bismarck model healthcare system, navigating through its unique pathways to reach universal health coverage and financial sustainability. Along the way, you will experience the system's benefits and challenges, climbing ladders and sliding down chutes that illustrate the heights and lows of the healthcare journey. Now, what are the objectives of this activity? The goal is to be the first player to reach the end of healthcare pathway, symbolizing a fully functioning, sustainable healthcare system that provides universal coverage and optimal outcome for all. By journey's end, players will gain insight into the delicate balance of managing healthcare costs, delivering quality care, and overcoming systemic obstacles within the Bismarck model. Now, come to the setup. The board is designed in a classic shoots and ladder layout. Players will start at the entry to healthcare system and advance through the finish line, which represents achieving universal health and financial stability. Along the way, you will encounter ladders symbolizing the success and strengths of Bismarck model, and chutes representing the common challenges within the system. The game elements which are involved here are: number one, the player tokens. Each token represents a healthcare administrator in Germany. These ones. Then the dice roll. Roll the dice to move forward and progress on the board. And number three are the cards. Draw cards at the designated spaces for special moves and strategic choices. These cards can introduce new policies, reforms, or unexpected health events, affecting each player's journey through the system. Now, you might be thinking about the gameplay. Let me tell you that. As you advance through the board, you will encounter ladders, these one, which are the positive outcomes, and these include the preventive healthcare programs. This one. This climbs up as the preventive care lowers cost and improves patient health. Then there is efficient sickness funds, these ones. Effective cost control by sickness funds improve care access and lowers expenses. Then we can see the innovative treatments. New treatments and technological advances boost patient satisfaction and healthcare quality. Then we can see the solidarity in actions. Contribution from high-income workers cover low-income cost, ensuring equitable access to care. Then we can see the government regulation success. Effective regulation keeps healthcare affordable and sickness funds financially strong. Now we come to the shoots, which are basically the challenges. As you can see, number one is aging population, this one. An aging population increases cost, stretches sickness fund resources. Then we can see the cost overruns, high treatment cost push up premiums, creating financial pressure on the employers and employees. Then we can see the providers shortage. Limited healthcare providers lead to longer wait times, reducing patient satisfaction. The administrative complexities, increased administrative work delays reimbursement and introduces insufficiency. And lastly, we can see insurance fund collapses. Mismanagement causes an insurance fund to fail, forcing a restart in contributions for coverage. Lastly, let us talk about special spaces. Policy reforms are in blue spaces. Landing here will let you roll twice, representing the positive effects of healthcare reforms. Then we can see the red spaces, which are basically the public health crisis. An unexpected health crisis causes a lost turn in the resource shift to address the situation. And lastly, we can see the choice space, which are purple, these ones. Drawing a card here lets you make a strategic decision, perhaps investing in wellness programs or streamlining processes, which affects your journey. Now come to the mechanics of the game. Roll to move. Roll the dice and move forward, experiencing the various aspects of Bismarck model as you advance. The ladders and chutes. Landing on a ladder sends you up, celebrating the model's benefit. Landing on the chutes brings you down, facing real-world challenges in healthcare system. And lastly, the choice cards. At a specific space, you may draw healthcare reform or crisis management card, prompting strategic decisions like investing in new technologies or adjusting administrative workflows. In the last, let us talk about winning the game. The first player to reach the finish line has built a systemic achieving universal healthcare coverage, financial sustainability, and high patient satisfaction. This journey symbolizes the ideal goal of Bismarck model, and along the way, players learn the intricacies of shared responsibility, control cost, regulatory oversight, and the inevitable hurdles in maintaining a high quality healthcare system. As the players progress, they will gain an understanding of the key elements of Bismarck model, like shared financial responsibilities, the role of sickness funds, and the importance of patient choices. The balance of benefits like cost control, solidarity, alongside challenges like an aging population and rising cost. The critical role of regulatory oversight, preventing care, and the need of innovation to sustain the system's success. And how different stakeholders face obstacles and opportunities, reinforcing the importance of collaboration. Thank you so much.
Thanks, guys. My name is Tyque McCarthy, and now let's explore the Bismarck model further as it stands today and envision what it may look like in the future. The Bismarck healthcare system is widely regarded as a model that balances universal coverage with cost efficiency and quality. However, the model has been facing some primary issues in today's market. To understand the full scope of the Bismarck model, we must first dive into the primary challenges. Despite its emphasis on universal access and social solidarity, the system grapples with disparities in healthcare access, particularly across income groups and geographic location. Let's start by exploring the impact of the healthcare disparities and the limitation that exists within the safety net programs. Income and geographic differences has led to unequal access to care, with rural communities facing significant barriers compared to urban areas. And as we go further into the exhibit, we focus on safety net programs, particularly health insurance coverage for most, but yet the low income and underserved populations still encounter challenges, risking a two-tier system. Containing costs, budget caps, and cost-based reimbursement aim to control costs has compromised service quality, especially for complex cases. And as the system moved to more of an outpatient focus, increasing focus on outpatient care enhances efficiency, but requires improved coordination and infrastructure to maintain quality and continuity for chronic patients. As we enter the exhibit for the impact on patient health, as we enter the new exhibit, we now focus on impact and patients and the population on patient health. The Bismarck system has largely enhanced population health, evident in the high life expectancy and low mortality rate, but increased privatization, selective care, contracting may threaten consistent care quality, especially for low income and chronic ill patients who depends on system health insurance. And as we shift from hospital to ambulatory care, the German healthcare system is increasingly focused on outpatient care to reduce costs and improve efficiency, while aligned with patient desire for less hospital treatment. But these transitions require better coordination and infrastructure to maintain high quality care, particularly for those with complex chronic conditions. As we move to the private equity and market influence on the Bismarck system, we learned that in particular outpatient service, which while particularly improving service availability, prioritizing profit over patient-centered care, may undermine the equitable principle of the Bismarck model. System consolidation. The consolidation of six funds has led to low administrative costs and more efficient negotiation, but has also restricted patient choice and intensified competition, which may result in funds favoring healthier individuals and potential disadvantaging vulnerable population, highlighting the need for careful regulation. Consolidation offers financial benefit but necessitate careful regulation to avoid compromising access and choices. And as we move to the final exhibit, we look to the future. We look to tomorrow for opportunities for improvement and for improving the equitability and equitable access to care and quality of service. Addressing the disparities, particularly in rural and underserved areas, could improve equity in access, such as public funding for low-income individuals, quality standard care types, and could further the Bismarck model solidarity objective. A more equitable funding distribution could help ensure every citizen can access the necessary care regardless of income and location. How do we balance the privatization and public access? By ensuring that private sector's involvement does not compromise equitable access to healthcare, and is a crucial task that requires solid regulatory oversight. Establishing a framework that prioritizes care within private entities is essential. This approach could mitigate the risks of profit-oriented decisions that might otherwise hinder access or quality, thereby ensuring a balance between privatization and public access in healthcare. As we go further, enhance preventative care initiatives can significantly reduce long-term costs and improve public health outcomes. The health system could focus on chronic disease management, from integrating digital health innovations and improving continuity and accessibility across care settings. Thank you for your time, and I hope this exhibit provided some needed information on our understanding of the Bismarck model today and for the future. Thanks, guys. My name is Tyque McCarthy, and now
So the key takeaways from the Bismarck model are that it's a mandatory insurance and universal coverage. The Bismarck model achieves near universal healthcare coverage by mandating health insurance for all citizens. This ensures that everybody has access to healthcare regardless of their socioeconomic status. Insurance is funded by compulsory contributions from both employers and employees, fostering a shared responsibility for health financing. Solidarity principle and social equity. At its core, the Bismarck model is based on the principle of solidarity, with healthier and wealthier individuals helping to support those who are sicker or have lower incomes. The model's structure reduces health disparities by providing comprehensive access to care, promoting equity across socioeconomic groups. Decentralized administration. Healthcare services are administered through non-governmental decentralized sickness funds or insurance funds, which operate with a high degree of autonomy. This structure allows for regional flexibility, competition among funds, and innovation, while the government ensures oversight to maintain standards and affordability. Emphasis on patient choice and satisfaction. Patients in Bismarck model system typically have the freedom to choose their healthcare providers and insurance plans, contributing to high level of patient satisfaction and autonomy. The competition between sickness funds and providers encourages quality improvement and responsiveness to patient needs. High standards of care and innovation. The Bismarck model supports advanced medical care and innovation, with Germany known for its high-quality healthcare services and investment in healthcare technology and research. Providers are motivated to maintain high standards as competition and patient choice push for consistent quality improvements. Cost control through regulation and efficiency. Although healthcare costs in Bismarck systems are partially controlled by competition, strong government regulations are in place to prevent overspending, including negotiated fees and budgeting mechanisms. The hybrid approach of private administration with public oversight enables efficient healthcare delivery and cost containment. The role of preventive care and long-term focus. Preventive care is strongly emphasized, aiming to reduce the incidence of chronic diseases and associated long-term healthcare costs. Preventive services, health screenings, and wellness programs are integrated into the system to maintain population health over time. Lastly, sustainability and adaptability. The Bismarck model has shown adaptability over time, responding to demographic shifts, healthcare demand, and economic pressures through incremental reforms rather than drastic overhauls. Its blended financial structure, reliant on contributions but supplemented by government support, provides resilience and flexibility, making it sustainable even in the changing socioeconomic environments. Thank you.